Now, doctor, one more thing that, you know, we is that everyone's wearing a mask. Now tell me, like, what do you feel like? How is that affecting your skin? Because you're sometimes, especially like if you're at home, that's a different thing. If you're in a closed environment, but if you're going out, you know, you're going to the office, you're going to be wearing a mask for so many hours. What do you
Yes.
think? How is that going to affect our skin? Is there a way to wear the mask? And are there any practices we need to do before and after we wear a mask?
Very, very pertinent question. So mostly kids are at home because they are safe, and 60 plus is at home because they are supposed to be the most vulnerable. So they're there. So who is the one who's venturing out? People between the 18 to around 50, 55, which is your best years of your skin and face. But in this time, you're still having a nicely oily, youthful face, right? This is the time when you're still prone for acne. This is the time when you're still probably end of it, you're prone for pigmentations. Now, when you wear a mask, just for a minute, think, what is it covering? Your T-zone, which is your most oily zone. And then you're breathing out into that place. When you're breathing out, the exhaled air is misty, right? So that again is sitting inside this. And then if you're in places like Bombay and Goa, which is very humid, this season was the worst season. This was the worst season to get COVID. So there is humidity there. So there is humidity. That is your actually most oily zone because it is your T-zone that you're covering. Most acne prone zone and sweaty zone as well. Even your sweat glands are most all over here. So now you're wearing a mask tight where you're exhaling, and then there is all of these glandular secretions in your face which is super active, and you're wearing the same thing for 6 hours. Imagine what is that khichdi which happens there.
Oh my God, scary.
And to top it all, there are people who are applying serum, moisturizer, sunscreen, and then they're going to apply a mask. It's going to be a mess.
So what do you do, doctor?
If you're stepping, please make sure you don't use 25 layers of creams. You don't need that. So you simply either, if you have a very sensitive skin, use a calamine lotion on your face. Or if you have an extremely dry skin, which is also irritated and red, then you end up using a very mild, inert moisturizer. Nothing with great active substances in it. Just an inert moisturizer. If your skin is oily, please do not apply anything. Wash your face and leave it alone. You can, of course, wear your eye care. Yeah, whatever is your eye care, you end up using that. And then you wear a mask.
Okay.
And the second thing you should take care is what is the mask made up of.
You're saying don't overdo the products when you're about to wear the mask.
Correct.
Okay.
Come home and then do your skincare regime. You can do that. And when you wear a mask, especially if you have an acne-prone skin or a very oily skin, please keep 2-3 masks with you. After every 2 hours, change the mask.
Okay, doctor, that's amazing. Thank you so much for answering that.